Hi guys, welcome to Nurse Minute Scoop, memory tricks in a heartbeat. Today I'll be talking about how to properly mix insulin and an easy trick for it. Let's begin. First thing you have to know is the fact that NPH is always cloudy and regular insulin is always clear. Those are the things that you have to memorize and remember. Next thing is to know that we have to inject air in both of the vials first. That's the first step. So it's air, and then after that you can draw and draw. So it's air, draw. So what do you put air first? You have to put air first on the cloudy one. So it's, which is the cloudy one? It's the NPH. So air on the NPH and then air on the clear, which is a regular insulin, and then you draw from the regular insulin, and then you draw our NPH. And how do you remember which one to draw first? Use the abbreviation RN. You want to be an RN, you want to draw regular first before NPH. So that's the easy way how to remember it. It's air, draw, cloudy, clear, cloudy. And then to draw it, always remember RN, regular to NPH. And that's it. I hope you like this video. Please don't forget to hit like, share, subscribe, and comment down below for more videos. Thank you for watching. Bye!